Hi everybody, I'm here at the Leonhardt's Launchpads laboratory at University Lab Partners, UCI Cove in Irvine, California. I'm here to give you an update on our progress so far in 2022. The most exciting development so far this year is getting a patent issued on October 22nd, 2022 by the United States Patent and Trademark Office for the bioelectric expression of circulating clotho. Clotho has been the subject of more than 3,400 scientific papers published since 1997 when it was discovered. The clear conclusion of those 3,400 papers is that there's a direct link between clotho and aging. If you're deficient in circulating clotho, you're basically aging more rapidly. Your aging is accelerated, and that includes all aging-related disorders: loss of memory, loss of hair, loss of sexual function, calcification of the arteries, hypertension, diabetes. Basically, you name it, and your risk is higher with deficient clotho levels compared to normal or elevated clotho levels. And what our patented technology does is increase circulating clotho by up to 150%. In the laboratory here, we've demonstrated as high as a 2,300% increase. This is really exciting technology. We've incorporated it into our BODSTIM suit, our bioelectric bodysuit, that when worn, let's say 40 minutes, 2 or 3 times a week, it's able to elevate circulating clotho up to 150% or perhaps even higher. To put that in context, if you exercise vigorously 3 times a week for an hour, you only increase your circulating clotho about 6 to 12%. So by adding our patented bioelectric stimulation technology, we increase this by more than 10-fold, which is quite exciting. We can't claim this in humans yet, but in mice that were supplemented with clotho live 30% longer. We hope we can prove that in humans. Right now we have FDA 510K clearance for a bioelectric bodysuit only for augmenting exercise, particularly related to building muscle faster, building more muscle in the same amount of time, and not cleared for any other indications of use. But what we plan to do forward in 2023 and beyond is do well-controlled clinical trials to prove out other applications. And boy, there really seems to be a lot of applications for clotho. For the brain, reducing the incidence of depression and anxiety and addiction, helping to recover from a stroke and traumatic brain injury. For eye cell, using it to reverse aging-related macular degeneration. For hair loss, for preventing hair loss for people that are prone to lose hair at an early age. Return of sexual health. Clotho has also been shown in clinical studies to be able to either halt or slow down tumor progression, or clotho is a tumor suppressor. We're planning to do a clinical trial with our startup Cancer Cell where we use the BODSTIM suit to try to stave off the growth of cancer tumors in cancer patients. All of this is quite exciting, and that patent was just issued October 22nd, 2022. We're happy to celebrate that news with you. But we're not stopping with just clotho, and I think you know that we previously received patents for stem cell homing with the controlled release of stromal-derived factor 1 and PDGF. We announced earlier this year we filed patents for the control of the SIRTine family of proteins, SIRT1 through SIRT7. These are also very powerful anti-aging proteins. Last week we announced the filing of what we believe is a pioneering patent application for the bioelectric expression of NANOG. We're also working on cestrons and many other patents. To summarize, we have over 700 patent claims that have either been issued, are pending, have been filed but haven't been published, or are in process, or have been licensed or optioned from others, all related to longevity and wellness, our core focus of our organization. That equates internally, we have filed about 50 patent applications over the past 60 months. That's very close to a new patent application filed every single month of the year for the last 5 years in a row. I'm going to update you now on our different groups within our organization, starting with the Heart and Cardiovascular Group. Second Heart, one of the flagship holdings of Leonhardt Ventures and a graduate of the Leonhardt's Launchpads Accelerator, is moving now to complete its first cardiorenal syndrome heart failure cases, probably in Canada in the early part of next year, and also in the United States, including Cleveland Clinic and Ohio State. We're just finalizing the last tests requested by the FDA, which requires a up to 5 more animals that will be done starting in the 3rd week of December. Leonhardt is our startup focused on total heart regeneration. We launched a series of animal studies at the California Medical Innovation Institute, AccuLab, in San Diego last year. We're planning to complete those over the next 90 to 120 days and hopefully set ourselves up to be able to do the first total heart regeneration clinical case in the latter part of next year or early 2024. Another holding of our heart and cardiovascular group is Valvulator, the first technology that's been designed to decalcify and regenerate heart valves to be able to allow people to keep their own heart valve instead of getting a cow implant or a pig implant or steel or plastic or cadaver implant. PressureStim is another exciting startup within our heart and cardiovascular group. This company has patents issued for bioelectric control of hypertension, high blood pressure. Clinical studies have shown the ability to reduce high blood pressure with intermittent bioelectric stimulation, approximately 20 to 30 minutes, 2 or 3 times a week. And we believe that this is going to be instrumental because many of the drugs that are used for hypertension have side effects, including fatigue. So far in our clinical studies using bioelectric stimulation to treat hypertension, there has been no noticeable side effects, particularly no fatigue. In fact, just the opposite. Patients report getting higher levels of energy. Our brain group has some very exciting updates. DepressyStim is about to move to clinical trials using bioelectric stimulation to treat depression and anxiety. A number of other independent researchers have already shown that bioelectric stimulation properly applied can treat depression and anxiety very well. We're coming forward with patented signals for controlling BDNF, serotonin, GDF-10, GDF-11, and other factors that we believe will be even more effective than other methods used to date. Within the brain group, we also have AddictiStim, bioelectric stimulation for treating addiction, MemoryStim for bioelectric improvement of memory. A number of independent studies have showed the right bioelectric stimulation can improve memory. Second Brain, which focuses on stimulating the stomach to release higher serotonin levels for also treating depression, but also to improve immune system. Cerebral is focused on using bioelectric stimulation and, when necessary, also stem cells and other biologics to treat stroke recovery, to help patients recover from strokes and traumatic brain injuries. We hope to give you more news about Cerebral development in 2023. Our cosmetic and personal care group is one of the most active groups in our whole portfolio. That group has 4 products moving to U.S. market launch in early 2023. That includes SkinStim, our bioelectric and, when necessary, biologics treatment for skin regeneration. HairCell, which has been used in clinical studies in South Africa and Pennsylvania and Utah for regenerating hair and growing hair. A recent study in Pennsylvania showed over 16.7% increase in hair density just by stimulating a couple times a week for short periods of time for 4 weeks. We're hoping to do a dose escalation study now showing if we stimulate for a longer time, such as wearing a bioelectric cap at home, that we can have even better results than 16.7% increase of hair density. BodStim, I mentioned earlier, is a flagship product that's moving to market the early part of 2023, particularly for the indication of augmenting exercise to improve muscle building faster and build more muscle in the same amount of time. In short, changing a workout that would of 20 to 40 minutes and having the same amount of exercise benefits of a 2 to 4 hour workout. In that product group is also ErectiStim. We've completed over 115 patients in clinical trials. 89% of those patients have basically been cured, hate to use that word cured, but have had great improvement of their sexual health due to the stimulation just a couple times a week for only 4 weeks. This is exciting technology moving to market in early 2023, all to be distributed by Leonhardt Health. If you have a chance, see lionhearthealthstim.com to see our beta website. Leonhardt Health, working with its OEM suppliers, has FDA 510K clearance for improving circulation, muscle treatment, and treating pain and inflammation. And with our bodysuit for augmenting exercise and growing more muscle more quickly. Another exciting development within our cosmetic and personal care group is orthodontocell. In previous clinical trials in Brazil and a limited pilot study in the United States, we demonstrated that we can straighten teeth within 3 to 6 months compared to Invisalign and other technologies that normally take 18 to 24 months. This is with a bioelectric mouthpiece that controls the expression of wrinkle, SDF1, PDGF, and VEGF for loosening up bone to allow teeth to move more quickly. And then also, after the teeth are straight, freezing them straight to be stabilized with the expression of BMP9 and OPG. That segues into implant stem, which uses that same OPG and BMP9 expression technology to accelerate the osteointegration of dental implants. In short, with this technology that we've proven in a pilot study and are about to move to a larger scale clinical trial, we have proven that you can put a dental implant in and be able to eat an apple or a steak in 1/5 the time that it normally would take for that implant to be stabilized and allow you to bite into those types of foods. Another exciting technology development of that group is BreatheStem, which is also supported by ArchStem. This is a whole technology suite for helping people to breathe better. And in this process, we've learned that better breathing at night, better breathing during the day is fundamental to health, and BreatheStem expects to have a major place in helping people to have a healthier lives through better breathing. TessyStem is a technology that has completed a pilot study and is moving to greater volume studies that is used. It's basically bioelectric underwear for testosterone management. We hope to report more results to you in 2023. Stem cell bra is a technology where we just finished our second pilot study. This one was in Spain. And in this study, 1/3 of the patients treated just 1 hour every other day for 4 weeks increased their breast size by 1 cup size. Another third of the patients increased 10%. 1/3 of the patients had no increase at all. In observing this, the results of the study, it was noticeable that the women that had the least amount of breast volume increase in this study were the ones that were the skinniest, that had the least amount of fat to work with. So we're seeing this correlation that this technology seems to be better serving those that have a little bit of fat in their body. We still plan to do many more studies before this brings to market. This product is brought to market, but we're excited with now 2 pilot studies. First, a safety study that was only a half hour a week and showed safety. And all of that followed more than 16 large animals that were completed with histopathology documenting the safety of this product and the great care that we're taking before we bring it to market. Another technology that was released last year is our Clotho Years test. I described earlier our BodStem suit. The Clotho Years test is a test that measures your circulating Clotho. So we're asking all patients who purchase or participate in the clinical trials for the BodStem bioelectric Clotho expressing suit that they test their Clotho level before they begin the program and then test their Clotho level after the program. We hope to share with you, and we hope to have published in 2023 the results from our comprehensive multi-center and multi-nation clinical trial. Our major organ regeneration group had a lot to report in 2022 so far. Bladder Cell completed its second clinical trial with positive results for using bioelectric stimulation to treat bladder dysfunction. Kidney Cell completed their second clinical trial, trying to help patients with failing kidneys to recover. The results were mixed, but we have hope that with some changes to the protocol, perhaps a longer duration of treatment, we're going to have even better results as we move to our third clinical trial. InStem last year reported a pioneering patent for treating inflammation with bioelectric signaling. This was issued by the United States Patent and Trademark Office. This is the first technology ever developed that measures the level of inflammation, the type of inflammation, and then custom delivers bioelectric signals to deliver exactly the right anti-inflammatory cytokine at exactly the right time in the inflammation cycle. This technology is in preclinical research now and about to move to clinical research. OrthoStem is our technology for treating knee pain and inflammation and also trying to regenerate meniscus and cartilage when necessary. We're planning to move that technology to clinical trials in 2023. iCell recently received Institutional Review Board approval to start our second clinical trial for using bioelectric stimulation for treating vision loss. We have high hopes for that study and look forward to reporting to you the results. Regeneron, along with COVIDstim, filed a patent last year on bioelectric control of fighting viral infections, including COVID. We completed a number of patients in the COVIDstim trial in Brazil. It's a very difficult patient population to work with, and we have not yet reported the results from that study. PankerCell had a major announcement in 2023 of filing a patent for bioelectric control of FAB-P4 and Clotho for attempting to reverse diabetes. It's very early in that research, but we look forward to making more advancements in 2023 and beyond and reporting those to you, and hopefully having a peer-reviewed publication showing that this technology can help patients with diabetes to have a pump and drug-free alternative for their treatment. The final group I want to tell you about is our cancer cell group. Our cancer cell group has 11 issued patents for bioelectric treatment of cancer. After finishing years of preclinical studies, we're now about to move to our first clinical trial, very exciting. In Brazil, we're going to wear the BODstim. The patients will wear the BODstim bioelectric suit. It'll be primarily focused on the tumor suppression properties of increasing circulating Clotho, and we look forward to share with you those results. Thanks for being with us on this journey. Thanks for investing with us, supporting us, helping us in any way that you, our stakeholders, have done. We are very grateful to have your support, and we look forward to reporting to you more and better results in 2023. Thank you.